Hi, I'm Dr. Bernie. I'm a homeopathic practitioner, and I'm in the Arizona area. So you can reach me at 480-703-0151. I see all my patients online now, which is a lot easier and safer for you. Or you can go to my website at gilbertnaturalmedicine.com. Today we're going to talk about taking your vitals. This is a stethoscope. And you'll see your doctors wearing it around their neck, see, and they do this kind of a thing. Okay, this goes in your ears with the little buds facing outward, not inward, outward, because it hooks into your ear better. And then tap it, make sure you get a good connection, you could hear it, and then you can hear your heart. Now, when you are taking your blood pressure, this is a manual blood pressure cuff, much better than the digitals, because the digitals always read 10 points higher or lower. So you would wrap this around your arm as tight as you can get it. Anyway, so you would wrap it around your arm as tight as you can get it. And then you're going to put this right here on the brachial part of the arm, like this, attach it to your cuff or just hold it. And then this is the pump. So you're going to make sure the pump is closed by turning this little lever. And then you're going to pump your cuff until it gets as tight as it can on your arm, or as tight as you can stand it. And then you would begin to listen to your heartbeat this way. And then you're going to see your pressure, your blood pressure, because it's going to read on the lever of the cuff, and it's going to show the two pressures you have, high and low, the blood that goes to the heart and the blood that's taken away from the heart. So you're going to, the first number you're going to hear, do, 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 and then it's going to drop, and you're going to hear the second. You're going to see the second level. So it's going to go do, 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 do. And that's your the lower pressure. I'm trying to give this to you in layman terms without using medical terms for you that you don't understand. A good blood pressure is 120/70. You know, that's a teenage blood pressure. So if you're 60 or 70 and you have 120/70, you're going to live forever. The bad pressures are anything that goes below 60 or above 150. So you don't want to get there. You don't want to go there. This is a pulse oximeter. They take your blood gas reading, the amount of oxygen in your blood, and they'll take this little guy and attach it to your index finger, and then they turn it on. See, and it's going to start reading how much blood gas is actually going through the bloodstream. And normal is 93, 94, 95. Anything in the 80s, you're not getting enough oxygen. Anything way high, you're hyperventilating. So this is an excellent little tool to have. You can buy them in your drugstore or medical supply. This is great for people that have COPD or emphysema, you're on oxygen, whatever, or you're feeling tired or dizzy or whatever. This is what you need to get. And when it's done reading, it'll just go off. And you'll be able to see the numbers on here very clearly. This is a child's blood pressure cuff. Very cool. For skinny people like me, you take this and you put it on your arm and you tighten it like that. And then you turn it on. See, and it'll start reading your blood pressure. In case you can't get the cuff on you because you're too large or too tiny, you use one of these wrist blood pressure cuffs. if you absolutely have to use a digital, realize it's going to be wrong. And if you go into drugstores, they have the machines you stick your arm in and it gives you a reading on your blood pressure. They're always wrong. Okay, this is a thermometer. You could take it and across your head, see, or you can put it in your ear and take it that way. It's basically for across the forehead, and it will read your temperature, what's going on with your temperature. You can, and they're infrared thermometers, so that's how they're able to get, when you go somewhere and you go to your doctor's office, they have to scan your temperature and stuff. This is a different and new way of taking the temperature other than sticking a glass thermometer under your tongue. When they can't take little babies' temperature, they usually put the thermometer under the arm or in the rectum. You could take your temperature the same way. If you can't put it in your mouth because you have a very strong gagging thing going on, you gag at anything you stick under your tongue or in your mouth, take it and put the thermometer under your tongue, or get yourself one of these guys at your drugstore pharmacy. That's about it. I wanted to make this short and sweet because I understand that people don't have a whole lot of time to listen to stuff. Maybe you learned something today, maybe you didn't. If you need help, again, call Gilbert Natural Medicine at 480-703-0151. We treat everything, every age. Thanks for listening. I'm Dr. Bernie.